Hello and welcome to Coronavirus Report. We are so glad to have you here with us. I'm in the presence of Pastor Stephen Bohr, Speaker, Director, President of Secrets Unsealed, Dr. Milton Teske, who is the Health Officer for Kings County and also happens to be the Chairman of our board, and I'm C.A. Murray. And we're trying to give you a perspective that is particularly Christian. There's so much talk about coronavirus, so many things that are being said, but we're trying to give you just a little something extra, a little something that you may not hear on the regular news. Dr. Teske is steeped in the knowledge and in this work, and as a Christian physician, he brings a very unique and wonderful perspective that we like to mine each and every week when you're here with us. So we want to thank you for joining us today, and hopefully we can say something that will be of interest and import to you. Good doctor, I want to start off, in fact, let's have a word of prayer, and then we'll launch off into our first question. Father God, again, we thank you and praise you for this opportunity to give information from a Christian perspective, given from men who have dedicated their lives and their hearts to you. Speak through us so that what we say can be of value to your people. In Jesus' name, amen. Amen. Each week when we come, we've got a new term or a new word or something new that you sort of spring on us. And this week's new word is Kawasaki. Now, I had heard about the syndrome, of course, keeping tabs on what happens in New York, but I didn't hear the name until just a few minutes ago when we were talking together. It is Kawasaki, not the motorcycle, not the automobile, but Kawasaki. Explain what that is and the effect that it seems to be having on young people.
Okay, so Kawasaki's disease was first described by Kawasaki and gave it his name, but it's been around for a while, so it's not a new disease, but it's new in its association with the coronavirus, with this COVID-19. It's a syndrome, it's a group of symptoms that come together and affects children primarily, although it can affect adults. For some reason, most all the victims of Kawasaki's are children, often under 5 years of age makes up the largest group of them, and can be quite serious and fatal in cases. Although again, it's a fairly rare syndrome. It has to do with the body's immune system being triggered and fired up in a certain way that it starts attacking the body and causing this group of symptoms. And of course, some of the severe complications that can go with it that we're seeing now with this. Nobody understands exactly how and why it's triggered, but it's associated with different viral diseases. Sometimes Epstein-Barr virus infection can trigger Kawasaki's disease, sometimes an adenovirus, sometimes some of the older coronaviruses that have been around for a long time. But just recently, they've been realizing that they're seeing quite a number of children that have this Kawasaki's disease associated with the coronavirus, this new COVID-19 virus. So here's what it is. It's a group of symptoms. There is no blood test, no lab test we can do to say you're Kawasaki positive or negative. So it's not, it makes it difficult to diagnose because today doctors want to test for everything and want to know from just let the lab tell them you've got it or don't have it. This takes clinical acumen. You've got to actually talk to the patient, look at them, and see what their symptoms are. Now, actually, it's quite recognizable, and hopefully, if you have children, if one of them should start to be affected with this, you would recognize it and direct them to appropriate medical care right away. It is a disease which treatment does make a difference. There is some treatment for it, and treatment can significantly lessen the serious outcomes to do with the heart and even fatalities. So you'll want to remember these and look them up and keep an eye out for them if you have children. Noticeably, there's a fever. Fever can come and go at different times. Well, this isn't anything new and different from anything else. The more characteristic things is you get inflammation of the mucous membranes, and we start to get like conjunctivitis. The eyes kind of get red and watery. affects the mucous membranes in the mouth. They can become inflamed and erythematous. The lips become very red, cherry red lips. Sometimes there'll be fissured or cracks on the lips as well. So that's a fairly characteristic look. The mucous membranes on down into the gut, and they often have very painful or severe diarrhea associated with it. So you've got those. There's lymph nodes that form in the neck right here, although they can in other parts of the body as well, but particularly those little bumps that swell up and are quite tender in the neck area is associated with it. And then there is the rash. And it's not like most rashes, little bumps and spots. It's just the face turns really red, erythematous we call it, but there's just the skin just turns really red, and together with that bright red lips, you can get the redness on the palms of the hands, or the soles of the feet will often turn red. On the hands and feet, when you get that redness there, a lot of times there's also some the skin starts peeling around the fingernails. The skin around this starts peeling back there, or on the toenails, same thing there. And so these are the outside things that we often see associated with this. And now the tricky part is not everybody gets all of those. And of course, a lot of those are sort of common to a lot. I mean, how many things cause diarrhea? How many things cause a fever? How many things cause conjunctivitis? So there's a lot of things there. And so it's a disease that is sometimes missed, but it's one we don't want to miss because there is treatment for it. And the concern with Kawasaki's is not those outward symptoms that we've just talked about, because those, they'll go away with time. But it affects the blood vessels. And we've talked before about coronavirus attacking, the lining of the arteries here. But this creates what we call a vasculitis. In other words, the immune system starts attacking the arteries. And as it attacks these arteries, this vasculitis, this inflammation of the arteries, it causes them to dilate. And as they dilate, they particularly can affect the arteries in the heart. This is the most serious place, although it can affect arteries in other places as well. It's particularly a note, one of the first things a doctor that suspects Kawasaki's is going to do, particularly if he gets it early on, is you want to get an echocardiogram of the heart. In other words, we're going to take an ultrasound, put it over the chest, and look very carefully at all the parts of the heart, particularly at the arteries. And they'll want to know their baseline, because as this Kawasaki's progresses, those arteries can dilate, and in some places they can form aneurysms. That means the artery just swells up and it's got this, very abnormal balloon-like that forms there in the artery. Those can clot off, and you can cause a heart attack in the heart. And they can form, you can get the aneurysms in other parts, other arteries as well, but the heart seems to be the big concern. It's really affected there. And so we want to follow that very closely.
Doctor, it sounds like you're saying this, you said syndrome, so you got a constellation of things that you're dealing with. It sounds like this is very painful, like the child is really suffering along with the corona, the COVID. This other thing on top of that makes for a lot of suffering during the time that
Well, yes, I mean, they've got a fever, they're miserable, and frequently diarrhea, which is often very painful and miserable in this particular case. So yeah, the kid is sick. It's not just running around, oh, I didn't notice my face was red. Yeah. This is a kid that's sick, they've got fevers, but this particular thing, the red face, the red hands or feet, or the really red cracked lips, those are kind of characteristic. When you see them with this picture, it's like, wait a minute, this isn't just something ordinary, this is the Kawasaki's.
Is that the child is so young, you're saying 5 or under, he may not be able to articulate what he's going through, so you really got to be diligent to watch, because you've got to pick up and speak for the child who may not be able to say, I'm sick, I've got a lot of things going on.
Yeah, but mom will notice. Yes, I've often found, I've been doing emergency medicine for the last 36 years, If you talk to mom, she'll tell you what's wrong with her kid.
right.
You know, moms know what's going on with their kids, and they'll tell you, no, look at this isn't normal. And that's very useful. Just as an aside, in other areas, one of the very difficult things is a neurological exam in a small child. But all you got to do is ask mom, hey, is this normal for him or is this not normal for him? And she'll say, wait, no, this isn't him. This is not usual. Okay? That trumps anything I say right there, you know. I see, because, hey, mom knows that kid. She knows his behavior. She knows the nuances of it. And she says, no, this isn't right. So I place a lot of weight on what mom says about their kid. And physicians that have been around for a while will. They realize that mom knows what's going on. She'll tell you. Now, she may know not what you know about medicine, but she knows about her kid. And she knows this ain't right and this is different than usual. And so, you know, you moms out there that watch, you'll know that this is coming there. But when you see these pieces that we're talking about, this is when you want to get to the pediatrician right away. You want to get in so you can get medical help right away, because there is some things they can do that can reverse or significantly shorten or stop the progression of this vasculitis that's affecting the arteries. That's the big concern, is the vasculitis affecting the arteries, and we can do that. And the treatment, two things. They will put the child on aspirin. It's an anti-inflammatory, and it helps cut that down. They'll put it on a high dose, anti-inflammatory dose initially, and then a more maintenance dose as we finish out the course of the illness. And then the other thing is IV immunoglobulins. This is a preparation that's actually made from someone else's blood, where they've drawn the blood, separated out the plasma, and they've concentrated the immunoglobulins, these antibodies, in other people's blood. And they give those, it's a general set of antibodies, and it seems to work quite well. Often a single large infusion significantly reduces the symptoms. If the fever still continues within a day, they may give a second or rarely even a third dose of the immunoglobulins. But it can really keep it from advancing in these dilations and keep it from forming these aneurysms. And it somehow blocks the immune system. There's these various proteins in there, and they're normalizing and blocking out this abnormal immune reaction that's causing the vasculitis. It's not necessarily an antibody that's killing the virus per se, as in the when we talked about the plasma therapies for COVID-19. This is a general immunoglobulin, and somehow it tends to help the body's immune system get back on the right keel and stop destroying the arteries.
I had heard of this new manifestation of the coronavirus, but I didn't recognize the name, Kawasaki's. How prevalent is the problem? I mean, I've heard that most of the cases have been in New York. There might be one in Los Angeles and a few other places.
That's correct.
So it's not real common.
There's been a lot in France recently. They've just, in the last week or so, they've got quite a few cases in France. It's like, they're just popping up at all the hospitals there for some reason. They're getting a lot of them there, and I'm not sure exact reason. Of course, there's a lot of cases in France right now, so it may just be a factor of the numbers. But
do they know why it afflicts one child versus another child?
No, they don't know that. Now, we don't have the answers to a lot of things as we deal with this. We do know that there is a difference, a racial difference, in the United States, maybe 1 in 10,000, and or is it 1 in 10,000? I think in the UK, 1 in 5,000 in the United States. Among Japanese, it's down to 1 in 1,000. Wow. They seem to have a much higher susceptibility. Some genetic something makes them more susceptible to this. So there's some racial differences in who is most susceptible to that. Wow. But As far as the exact mechanism by which it works or why one person is more susceptible than another, we don't know. It's really a fairly uncommon and rare disease. I mean, considering how widespread the coronavirus is now, you know, as we started with things in New York, what was it? Over 20% of the population has already been infected. Generally, children have very mild or asymptomatic cases of the coronavirus. Why a few of them develop the Kawasaki's is probably the same with the others. Adenovirus, that's the common cold virus that comes around every year and everybody gets the adenovirus. And almost nobody gets the Kawasaki's, but there are a few children that do. You know, and so we don't understand exactly all of these details, but it is out there, and it is serious enough that it's considered the #1 cause of acquired heart disease in America. In other words, this Kawasaki, you know, some heart diseases you're born with and some you cause by what you eat, but this is caused by this particular disease process, you know, strep infections, you know, rheumatic heart disease is another one that can affect the heart valves. But this Kawasaki's disease making these aneurysms in the coronary arteries is, you know, is a serious thing. And, you know, if a child starts to come down this, we certainly want to get them treated right away to try to prevent it from forming these aneurysms in the heart and to, you know, these dilated vessels and stuff. Now, in a lot of cases, even though the fact that they're starting to get the dilated vessels or maybe even starting to get an aneurysm, in a lot of cases, those will go ahead and resolve. They get the aspirin and the immunoglobulins, and over the next, you know, few weeks, as the resolves, those will come back to normal and they'll have no further problems. But in some cases, if they've gone far enough, they don't. They become a permanent problem there in the heart.
So the question is, there's a few children that have passed away as a result of the. Is it a combination of the Kawasaki's and the coronavirus, or have they died because of the coronavirus? Is it a compound issue?
Yeah, it's all of that together. I mean, one of the things, when we have this vasculitis going on and everything's dilated, it sort of makes, you'll often refer to the disease toxic shock syndrome. It's sort of like septic shock, where certain infections make toxins and the blood vessels dilate and the blood pressure drops and they're in shock, and we're trying to put in IV fluids or even, you know, IV pressor agents and stuff to keep the blood pressure up, to keep them alive. And these children can go into that with that. And it seems to be related again to the vasculitis affecting that. It's like a toxic shock syndrome. They can go into this hemodynamic thing where they go into this toxic shock syndrome. And, you know, it's very life-threatening at that point. And as I mentioned, in some cases, these aneurysms can clot and stuff, and we can, you know, have heart attacks, you know. Yeah. You don't think of a 5-year-old as having a heart attack, but yeah, if you block off an artery, yeah, we've got a problem there. So early recognition and treatment with aspirin and immunoglobulins is our best course on those few children that get that. But again, it is rare, it's a few. Most people will have nothing. And even of those that get it, you know, when it's recognized and treated, they can do okay.
That's the good news, that it is eminently treatable when caught.
Yeah.
Yeah, praise the Lord. Pastor?
Well, I'm trying to think about how we're going to frame the rest of our discussion today. We've been wanting to talk about lifestyle issues, and that's been for the last 3 or 4 programs. We've never gotten to that particular issue. But let's frame it this way. There's a lot of talk in the media today and among political parties about health care being a human right. On the other hand, you don't hear anything about a person's health being a personal responsibility. And so, you know, there's this discussion of people who smoke, they drink, they eat lard, and they eat bacon, and all these things that cause artery disease. And the people who are very healthy, of course, they have to pay for the health care of those people. So shouldn't we be focusing more on prevention and taking care of our bodies rather than cures?
We always bear a responsibility. It's interesting, though, in the legal area, in the political arena right now, not right now, but recently and in the past, we do recognize that in some cases. Why do we have motorcycle helmet laws and bicycle helmet laws now? You have to wear a helmet when you're out riding. Because everybody else shouldn't have to pay for your quadriplegia for the rest of your life if you weren't wearing a helmet and you could have. Right. And so we pass laws to protect you, but we only go so far in certain areas, We don't arrest people for smoking or for eating hamburgers yet. and I don't know that we should.
I'm not talking about arresting. I'm talking about the issue of paying for their health care. Yeah. Because this has to do more with long term. It's not like having an accident and you don't have a helmet and therefore for the rest of your life you're quadriplegic.
Yeah, and when it comes down to it, in a wealthy nation with not too much disease, we can afford to pay for everybody's health care. But as health care gets more expensive and disease gets more extensive, those soon run out of the ability of possibilities, and you start limiting health care. And that's when the personal responsibility really falls not on everybody else, but back on you. Because sooner or later, there won't be enough CT scanners, MRIs, and all of the special imaging things. There won't be enough lab tests for there won't be enough, drugs, particularly some of these really expensive ones for everybody. And then if our healthcare resources get overwhelmed in a pandemic, like we have seen in New York and other places, suddenly all of the resources are used up taking care of the immediate emergency, and everybody else that has another medical problem is pushed on the back burner. They start canceling all of those things. They start thinking, but the other, our insurance companies start denying certain things, and well, this is no longer essential, or this isn't a covered benefit anymore, trying to just deal with the reality of there's not enough money in America to pay to do everything for everybody when everybody's sick. And so your health really comes back to your own responsibility to preserve your health. God gave health to you as a right. You have a right to good health. God's promised it to you, and He's promised to maintain it for you. Yeah. Not only has He given us wise advice on, you might say a prescription from the doctor to sunlight, fresh air, drink lots of water, eat lots of fruit. He starts giving us those prescriptions. Now we can follow them or not follow them, but health comes from following them. And even beyond the prescriptions of health care, He's told us that, I am the Lord your healer. That's His title. He's our healer. Salvation and physical healing are so intertwined when we talk about Christ's work to redeem and undo all the evil that Satan has done in this world. And when He came here 2,000 years ago, He spent as much time going around miraculously healing people because that was His mission. Not just to get people interested so they would listen to Him. It really was His mission to restore health. And
physical, mental, and spiritual.
Yeah, that was really definitely part of His mission. I understand that the New Testament uses the same word for salvation and healing. Yep. And well, I'm not proficient in those languages. I have been told that item, and I think there is a lot of insight to be gained in understanding the closeness of those two, how closely healing, physical healing, is connected with spiritual healing. Those two go together in so many ways. You know, we could talk for weeks about the connection between those. Yep. You know, but we understand the health principles. They form a huge big part of our part in cooperating with God, much in the same way that He gave us 10 commandments. And as we cooperate with those, it's how we cooperate in our spiritual healing. You know, Spirit comes to do both of these in us. The Spirit heals our body and the Spirit heals our soul, but it does it through our cooperation, our submission, our surrender, our absolutely giving into God's way, recognizing Him as the ruler in our lives. And as we do that, we place Him in a position where He's free to go ahead and do miracles that go even beyond fruits and vegetables.
Yep.
You know, I like the story of Naaman, you know, the Syrian captain that came down to Elisha with these incurable disease. There was no physician at the time that had anything to offer, any hope to offer him. And we have diseases today in which our physicians have no hope to offer us. But he came with this, and he went to him and had heard that he could do miraculous healings because of the witness of this little girl. And when he got there, Elijah didn't even come down and talk to him. Right. He basically said, sent his servant down. Just his messenger, and
didn't make Naaman too happy, did it?
No, and he said, just go wash in the Jordan River 7 times and you'll be healed. You know, and then he was really mad, you know? He said, I got really taken on this one. The guy wouldn't even come talk to me, and I brought, and he was mad. And
and the ugly river at that, you know, compared to the rivers he had at home, which he said were much cleaner. Yeah, he sent him to this mud hole.
But finally his friends prevailed. Well, just try it. So he went out to the river, he dipped 7 times, and on the 7th time, he was miraculously healed. Now, was it the water in the Jordan River that healed him?
No, I think not.
No, of course not. You know, it was God's miraculous healing power.
Amen.
But if he hadn't gone and dipped in the river 7 times, would God have been free to heal him?
No.
No, if he had gone back and said, I'm going to dip in this other river, no. God's, you know, He comes to all of us with that option.
Well, time is up.
Dip in the river.
We'll see you again next time on Coronavirus Report. Stay healthy, stay well.